We have a great question from Bianca in New Zealand, who is an aspiring birth worker. She'd like to become a doula, but she has a few questions before she does. One of her main questions was, I really want to become a doula, but to be honest, the prospect of possibly being at a birth for 35 hours plus scares me. Can we please go a little bit more into detail? What do you do to pass the time in those instances? And how do you do it? Awesome question, especially if you're considering working in the birth system as a doula or as a labor support person in general. So we call these marathon births, and because labor times can vary so drastically, it's important to talk about the fact that some births actually do go to 25, 30, 35, 45 hours. The amount of work you put in prenatal appointments with your client is really going to dictate at what point you're called in when she's actually in labor. So ideally, in a perfect world, you put in all this awesome work to empower and strengthen your client prior to birth so that when she's actually in labor, she can support herself until she's in really well-established active labor, and that's when she needs you, and that's when you come in. By doing this, you're minimizing time, so obviously that you'll be at the labor, but as a doula, you want to have the most energy possible. You want to, be functioning at your optimal, awesome self. If you're stretched out for hours and hours and hours, you're doing nobody a favor, and you're actually doing a disservice to yourself and to your client. And it's really important to explain that to them. So in most cases, they're happy to call you when they really, really need you. First-time moms is a little bit tricky because sometimes they can, be quite anxious. They've never felt these feelings before, and they might want you to come early. And that's when I feel that marathon births are more relevant. For example, I called my doula, the second I was in labor because I was so nervous. I was so scared, and her presence was so important to me that I just needed her there immediately. God bless her, because she was there for such a long time. But I definitely learned from seeing what I put her through that it's so important to just call your labor support person when you sincerely need them. And this way you can use them at their optimal self for that period of time. It's really different as well between women. So some women in their birth space, they really love a distant approach from their doula. So they prefer that the doula actually sat in the background and didn't do anything physical per se, but was there as a strong beacon of support and emotional support just with their presence. Whereas some other women really want their doulas to be physical, and they want their doulas to provide verbal support and physical support. So it really depends on the women and how much energy you're going to be putting into it. In well-established active labor, you're going to be doing things like massage, trying to move her into different positions to help with optimal fetal positioning. You're going to be, speaking to her in different ways and supporting her in different ways. There's so many variables to take into consideration, but for the most part, marathon births don't happen all the time. That being said, knock on wood, it has happened to me many times, and I know many doulas who have lived this over and over again. But I think the bulk of my answer is don't be scared, don't be intimidated by that prospect. Of course it's going to happen, and if a woman really needs you, she's going to call you. If you get the opportunity to nap, take naps, make sure you're eating, make sure you're taking care of yourself, and make sure you have an awesome backup who can take over when you've reached that point that you're of no use to anybody because you are so damn tired. And that's basically all I can tell you. There's a lot of things to consider, and this all fits into the lifestyle aspect of things, but please don't be scared by that sort of thing. You're totally gonna rock it, and births are what births are, and nobody's gonna change that. Just make sure you prepare your client and yourself adequately prior to the birth to really maximize that time and energy you put into the situation. Thanks for your question. Terry from the US of A has a question for us. What is the main difference between a home birth and a hospital birth, besides the obvious? Wow, I could go on about this for ages because there is just worlds of difference between both of them. So in a hospital or birth center setting, it tends to be quite sterile and clinical, and a lot less personal. And even if you have, you know, the loveliest midwife or the loveliest nurse, you're still in the kind of environment where there can be 15 people in your room. If there's an emergency, you have, you know, student midwives, student nurses who are watching. You don't really have that privacy. You have quite bright lights. It's just not the kind of ambiance that a lot of women thrive in the birth space. So obviously you have you know, great access to those amenities that a hospital can provide. So in an, you know, extreme emergency situation, or doctors and surgeons in the flick of a light, certain pain relief, and for those reasons that's great. But in a home birth, it's all about creature comfort. So you're in your own element, you feel nice, you can be naked, you can have candles, you've got the incense going, you're in your zone, you have all the people you love around you, you can dictate what support people you have, your midwife who's still adequately prepared for emergencies is there for you, you can have your beautiful birth pool, you can make all the noises you want, you can have pictures that mean a lot to you, birth affirmations, you can create a birth environment that suits you and suits your soul. And this is not just for hippies, this is for everybody that can benefit from a beautiful birth environment. And it's really about breaking down that stigma that home births are only for super crunchy, you know, hippie mamas who want to have incense burning. It's really for people who are all about creature comforts and being in the comfort of their own home. Hospital births are, you know, beautiful in that sense where you have access to the things that you may need. And for a lot of women, you know, they actually thrive better in a hospital setting because their mind's at ease. They know that if anything happens, their child and themselves are cared for immediately. So I guess it just depends what the woman wants and what the family wants. But I just love home births, as you can tell. And I think that it's more of an environment where you can create the ambience that feels the best to you. And in worst case scenario, you can go on and transfer to the hospital anyway. So I definitely do recommend it. And actually many doctors are on board with the idea that women should stay at home at the very minimum till they're in well-established labor, to avoid premature transfer to the hospital. But they have, you know, the best chance at getting the birth they want by doing so. So that's basically the main differences. For more information, you can just Google, you know, statistics for home birth, statistics for hospital births, different testimonials, and that'll give you some really great insight on why people choose the options they do. Thanks for your question. Charlotte from Mandra asks, my husband seems quite standoffish when we talk about birth in general, and I'm getting the impression that he doesn't actually want to be at the birth of our next son. How should I deal with this? Charlotte, this is actually something that's really, really common amongst partners and men and you know, men or women, whatever it is, because birth is a pretty crazy time, and it can be confronting, especially if all the experience and all they've ever heard about births is quite scary stuff from their friends or from TV or from their mother or whatnot. And so for partners in particular, it takes them a bit longer to warm up to the idea that they're going to be, you know, going through this massive life event. The moment you get pregnant, you start connecting to your baby, okay? So you have 9 months, 10 months to prepare mentally for the birth itself. But for your partner, it really doesn't become real till the last moment. And then they're flooded with this intense, you know, slew of events, and it can be confronting, and I can totally understand that. It's really important to mention that if your husband doesn't feel comfortable being in the birth space, you don't need to force him to be there. It's not doing you a favor, and it's not doing him a favor. I've worked with, you know, partners who have decided that they were, you know, best suited to staying in the waiting room or to being quietly at the back of the room. Excuse me. In those instances, I really suggest getting a birth support person, so a labor support person or a really good friend or somebody that can support you adequately while your partner enjoys the process. Things like cutting the cord can be quite freaky for some partners. I've dealt with that before, and that's okay too. There's no pressure. I don't think that making your husband or a man or your partner do anything they don't want to do is just, it's just off for me. It doesn't make sense. You want them to enjoy the experience as much as possible. It doesn't mean they don't love you. It doesn't mean they don't love the baby. It's just they've been conditioned to be, you know, a bit standoffish about these sorts of things, and that's all you can do really, is accept that and honor their feelings. You know, have an open dialogue about it and see if you can meet somewhere in the middle, and try and get a labor support person or another support person who can tag along that journey with you. Thanks for that great question, because I know a lot of women that are going through it at the moment. Emily from Perth asks, I'm pregnant and due in 2 months. My 2-year-old, who I'm still breastfeeding, seems really attached more than usual, and I'm getting worried about transitioning to feeding a newborn. What should I do? So I'm actually dealing with something really similar at the moment. My daughter is 21 months and still breastfeeding, and I've noticed, strangely, that she is even more of a booby monster than she was when she was a newborn. So she's literally attached to me at all times. And when I did the research into it, I've noticed that actually children are quite receptive to, in pregnancy, changes in hormones, changes in taste of the milk, and it's almost like she can sense that something's coming and that something's going to change. So she's been particularly clingy, wants to be attached, wants to be close to mama. It's been really challenging for me, to be honest, as my milk had dried up probably around 18 weeks. And only now my colostrum is coming back in and I'm 23 weeks. So we went through something called a dry nursing spell, and it made me absolutely crazy, if I'm being honest. Really tender breasts. I couldn't understand why she was constantly stuck to me, especially because there was no milk. And so she was having, you know, all this food and all this milk during the day, and she was still attached to the breast. So apparently there's something that happens where their physiological response to the lack of milk, excuse me, is similar to a newborn who cluster feeds. So they feed incessantly in an attempt to bring that milk back in. But I just think that she knows something's coming and she just wants to be really close to me. And this is where I find a lot of solace and comfort in the fact that there is a new baby coming, and as much as I feel really challenged and really defeated and really overtouched when she wants to be nursing all the time, I'm trying to just appreciate the fact that, you know, I'm gonna not have this one-on-one time with her when newborn baby comes. And even though we'll be tandem nursing, I'm sure it's obviously going to be a completely different dynamic. If you're feeling overwhelmed, or if you have any questions in terms of, you know, what happens to breast milk in pregnancy and what changes, I really suggest reaching out to a lactation consultant. And if you're in the Perth area, I really recommend Sean Leach. She works out of King Edward's. And just getting to know your body and, you know, what's happening and why it's happening and why your children is responding the way they do. And then possibly looking into breastfeeding support groups or breastfeeding hotlines, because that gives you some really great insight on just about anything you can imagine if you can't make it to a lactation consultant. Good luck with it. I know that it can be a little bit bonkers at times, but just try to enjoy the time you have with your daughter. Thanks for your question.